So the Pucci Wellness Center and the Pucci Wellness process, right, that we've created a solution for, literally thousands of clients from all over the country. And this process has been forged through a rigorous reevaluation of our process. I'm in practice for 30 years. So we didn't get here. The processes that we have today were not just birthed overnight. This has been developed over decades of what's worked and what hasn't worked. And I can sit here with confidence and tell you that our processes work extremely well for the patients that are the right fit, that are motivated. Okay, this is why we only partner with people who are the right fit and we get outstanding outcomes for them. This is the process that attracts patients, and it does attract doctors also. I treat doctors from all over the country that have come to our office physically and or virtually. You know, one of our secrets is part of our success formula is that we support you. We support you, each step of the way. So let's just kind of talk here about the differences between what is a medical approach and a holistic functional root cause approach, using the tree as an analogy, right? So again, there are names, diagnoses, right, of conditions: diabetes, heart disease, heart attacks, strokes, cardiovascular disease, autoimmune diseases, which are now epidemic. There are more people with autoimmune diseases in this country than heart disease and cancer combined. Can you imagine that? Autoimmune diseases from Hashimoto's thyroid to lupus, multiple sclerosis, rheumatoid arthritis. The list goes on and on and on. Ulcerative colitis, so forth. Okay, thyroid diseases, various types of arthritises. I said rheumatoid is an autoimmune disease, but also psoriatic arthritis, anxiety, depression, chronic fatigue, digestive problems. Just the list goes on and on and on. So in the medical model, right, there is a drug and or a surgical procedure for all of these things. But if you look at the root causes of what is driving these conditions, how do we develop diabetes in the first place? Now, many people might think, it's genetics, but we now know that your genes are actually 85 to 90% of your gene expression is affected by your environment, your lifestyle habits, your dietary habits, right? So your genes are not your destiny, but you want to look at, is your diet an inflammatory diet or not an inflammatory diet? Is your diet, helping you to have good energy, or is it distracting and pulling energy? Is it supporting your immune system so you have a strong immune system, or is your immune system being weakened because of your diet? Okay, toxic relationships, sure, right? Poor self-image, a sedentary lifestyle. Exercise is critical. Your body is intended to move. Just general toxicity, environment. So the environment, everyone is toxic today. We live in a toxic world. There is just no person who's not toxic. It's just really a matter of how toxic is the individual and how well is the person's ability to remove those toxins. So we have some control. We can try to do some things to try to remove and so we have less exposure to toxins in the world, right? Less toxic foods, right? Maybe eating organic versus processed food, so forth. But we also have to pay attention to our own body's toxic loads and making sure our detoxification pathways are working well. An example is that as many people I see don't move their bowels every day. It's way too common, right? And if you're not moving your bowels every day, then you're not eliminating toxins. So these are just a small segment of root causes of conditions, right? So if the leaves are turning brown, right, cutting the leaf off isn't sufficient, right? If the roots are rotting. So you're kind of getting the sense that having a root cause approach is a foundational functional medicine approach. And by changing and addressing these root causes, we can turn this back into a healthy tree or into a healthy life. And that's how you begin to reverse chronic degenerative diseases. So let's take a look at the journey from pain to pleasure, and really exactly what is functional medicine. Right? So functional medicine is a personalized root cause medicine program, a root cause approach. It's an in-depth review of your case, customizing nutrition and lifestyle design, okay, and having comprehensive medical consultations. So what you see here is, where do you start? Where does anyone start? Right? Well, it's often said, right, as a 1,000-mile journey starts with the first step. So the onboarding is the beginning, right? It's having that initial 15-minute free complimentary discovery call to make sure that you and I, our processes align and that we are a right fit. Right? And if we are, then welcome aboard, and we start. And we begin with an initial consultation. That's a 75 to 90-minute consultation to review your history, what other types of doctors you've worked with, other types of procedures and medications you've worked with, or holistic doctors you've worked with, what's worked, what hasn't worked, get a better understanding fundamentally of what systems are out of balance, so that right out of the gate, we can start moving you and helping direct you in the right direction. But you can see that these are sort of peaks and some valleys that we kind of need to go through. So ultimately, what peak you want to get to is your goal. We're here to help you, achieve that. But once we get past the initial consultation, from that consultation, I'm going to make a determination and discuss with you what particular labs are going to be beneficial for us to help figure out what is at the root cause is, and where do we really begin and start putting our priorities and our energy into to start making changes. Right? So there's a lot of different tests to choose from. So it's my goal in the beginning to try to see, which particular tests are going to give us the best value, the best bang for the buck, as they say. Now, in between, when these tests,